Hey guys, we're here with Anthony today and we are going to do a scoliosis treatment. So come over here, you can check out what we're working on. He's got a curve bowing out to the left side. That's a convex curve to the left, concave on the right here, and his hips are off level as well. So we're going to go ahead and do adjustment and traction and power plate training today to help with the scoliosis. So his is an S curve, so it does bow out convex on this side up at the top here. So we're just going to do a little treatment. Bring him over here, boom, right in there. Then we're going to have him lie down face side, this side up. Adjust him at L3 here on the left to close down the wedge that he has going on bowing out to this side. So we're going to go in here, we're going to do a counterclockwise torque, relax here, and then adjust that there. Then we'll have him go over to the other side. Side here, we are going to adjust his hip. So on the left side, his hip is down. So we're actually going to give him a posterior inferior adjustment and push it back up. Just like that. Then we're going to have him lie down face up. I'm going to use my magic tool here. Call this the highlighter adjustment, knuckle saver. And this, we're going to just loosen up all of his thoracic because we're going to be doing some traction in that lower thoracic area. And so we're going to come in here and do an anterior dorsal maneuver. In fact, I'm going to bring him up and flex him over here and adjust there, and get one down here at the top. There we go, loosen all that stuff up. Now he also has loss of his cervical curve, and we're gonna do a cervical adjustment, lateral to medial with a little bit of posterior to anterior adjustment to help induce a curvature into his neck. A lot of times when people have scoliosis, we're adjusting at C5 here, they'll also lose the curvature in their neck. So he's using a Dentaroll at home, a foam block, to help restore his neck curve. That part he does at home, but the more advanced scoliosis traction we do here in the office. So let's go over there to our scoliosis table. So this table is a Hill Labs AutoFlex table with the scoliosis attachment. This is the table used by the Clear Institute, which is the top of the line scoliosis treatment, non-surgical scoliosis treatment that you can find. And so what we're doing here is he's got a convex curve on this side. So we're going to be pulling in on the lumbar spine while stabilizing his pelvis and his lower thoracic. So it's a very targeted traction. So we're going to use these ratchets here to bring him down. There we go. How are we doing so far there, Anthony?
Pretty good.
Okay, I'm going to go a little more. And we're going to set him for 20 minutes now. So typically this type of treatment, you're going to do it 3 times a week for about 3 months. That's 36 visits. And we're going to have this table stretching his spine out. So he's getting an axial traction at the same time that he's getting sideways traction. We're going to come in about halfway and tighten this up as his muscles relax. So what happens is the first 10 minutes or so, his muscles are going to kind of fight it. And then they're going to start to relax and these straps are going to sink in further. And then we're going to actually tighten it a little bit more and actually start to make some corrections. So the second 10 minutes, we're actually making the most correction to the shape of his spine. And we should get pretty good changes on his post x-ray. And the cool thing about this table too is it has a headpiece that slides. You can notice it just subtly sliding back and forth, which makes it more comfortable on his face. So this is not the most comfortable treatment ever, all right? Yeah. It's not the most comfortable treatment ever, but it works. And we try to keep it as painless as possible, but we are stretching it. Just like if you had crooked teeth, we'd put braces on. It gets a little sore when they tighten it. It's the same with the spine. All right, so now we have Anthony here. He's on the power plate. We have him doing some spinal stabilizing exercises because ultimately with the adjustment, we're loosening up the bones. We're pushing them in the right direction. People will argue, hey, chiropractic can't really change the shape of the spine. It can, especially if it's stuck in a certain area and you move it, but really it's the traction that he was just in that moves the shape of the spine. Now we're actually having him do exercises on a machine called a power plate, which vibrates, and it makes basically any exercise you do on it more effective. And it's particularly for scoliosis, it's great because the vibration stimulates his nervous system, stimulates his balance, and basically helps the stabilizing exercises that he's doing become more effective for his scoliosis.